Coming to you from Beaumont, this is your house call.
The recent COVID surge pushed pause on so many of our lives. Between state and federal guidelines advising us all to stay home and shelter in place, to the closing of non-essential businesses, it probably comes as no surprise that healthcare for many patients has taken an immediate backseat. But now, as we start to see the light at the end of the tunnel, there's a renewed emphasis on getting the important time-sensitive care that you need. And that time-sensitive care includes things like diagnostic and screening examinations such as CTs, MRIs, mammography, and other imaging. So what exactly are we doing to provide a safe environment for our patients as they proceed with these important tests? That is what we're here to discuss today. Hello and welcome to the Beaumont HouseCall podcast. I'm Dr. Nick Gilpin, and my goal is to help you and your family live a smarter, healthier life. Today's conversation is an update on COVID-19. Joining us on the podcast today, we have Dr. Lisa Awan. Lisa is a radiologist at Beaumont. Her specialty is breast imaging and screening. Today's focus is on COVID, specifically on what we can expect when we're scheduling those important diagnostic and screening exams in the age of COVID. So with that, welcome Lisa to the podcast.
Hi, thank you for having me.
You bet. Let's dive in. So what have the past couple months been like for you? This is probably pretty crazy, right?
Yeah, definitely. At the Beaumont Breast Care Center in Dearborn, where I work most of the time, as part of the COVID response and orders, screening mammograms were all halted, and only patients with urgent diagnostics were coming through. Therefore, we were really only seeing about 1 to 5 patients a day, as opposed to the normal 100 some. And it's been really strange. It's been quiet, and definitely time has come now to be able to do some of the screenings that we were missing out on.
Absolutely. And what you're saying, I think, really mirrors what we're seeing in a lot of other spaces, too. So we've done a few of these podcasts now with emergency medicine and surgery and some other experts, and everybody's story is very similar. You know, we all got crushed under the weight of this thing from March and April, and now we're starting to have this re-emergence back to this new normal and trying to get back to business as usual because we recognize how important it is to get that care. What kind of questions were you fielding during this time? I mean, I know you probably were shunted into more dealing with COVID patients or imaging, but what kind of things were people asking you about putting off their medical conditions or screenings?
Yeah, people definitely were asking me if it was okay to postpone their screening exams, such as mammography. And initially, a few weeks or even a month seemed reasonable and obviously necessary to help the hospitals battle COVID. However, now it's been almost 3 months, and these screenings at this point definitely should be resumed. So anyone who's asking me questions now, especially women with lumps that they've been feeling maybe since March, or women that we actually initially called back from their screenings done even way back in January and February that had to cancel their follow-up appointment, I'm definitely telling them now is the time you need to come back in.
What kind of things have you been noticing recently? Do things seem like they're letting up? Is this new normal starting to feel a little bit better?
Definitely, yeah. In the last few weeks, I was back at work for about 2 weeks, and our patients are slowly returning to the breast care center. Our current focus is mainly on diagnostic patients that need to be coming back for those workups of the lumps that they've had or findings that we detected on their screenings. And, changes have been implemented in ways that we're taking care of our patients as well.
So I know that your specialty is breast screening and imaging, but what are some other of the common screenings that people probably put off while we were dealing with the COVID surge?
Probably, other than mammograms, my guess would be colonoscopies,
Sure.
stress tests, pap smears, other imaging such as the CT lung screening exams have all been put off, and even some cancer workups have been put off during this time.
Talk about why it's important that we should not be delaying these important screening exams, and do you have any examples that you can share with us about that?
Yeah, we definitely want everyone at this point to be assured that we're taking all the necessary precautions and that it's important not to delay the detection, the diagnosis, and the treatment of breast cancer. As always, early detection is key, and our treatment improves and is based on how early we're able to detect these things. So real life scenario, just in the past few weeks, I've just personally noticed, this is just anecdotal, but I've noticed that some of the women coming in with lumps, their cancers are bigger. I had 2 patients last week with breast cancers that were 4 centimeters in size, that usually is not the case. I mean, women that feel lumps, they're coming in when they're smaller. I know it's only been 3 months of time, but some women do have higher grade cancers, especially younger women, and those are the patients that I'm the most worried about.
I agree with you. And I think I want to put a little bit of a finer point on that, because I believe that putting off those screening examinations in March and April, when we were getting hit the hardest, I look back on that and say, we did the right thing. I really do think that. I think that we were in such a place that we had no choice. We had to divert those resources to care for those sickest patients. I don't think it was an ideal situation. I'm sure we can both agree on that. I think it just puts extra emphasis on, if you have put off those screening tests, you need to get back in here and make sure that we can get those things done.
Yep, definitely agree with that.
Talk about how a mammogram or any imaging test like a CAT scan or MRI or whatever, talk about how that is done differently today. How are we keeping our patients safe?
Yeah, so definitely at our breast care center, we are currently triple screening all patients for COVID prior to their appointments. We have appropriate PPE for patients and staff. It's available widely now for the most part. And we're also screening our own staff daily. Patients are currently changing in dedicated areas, usually directly in the same room that they're going to be having their mammogram in instead of a changing room. And they are placing their belongings in bags, which then they can carry with them throughout the department to avoid touching lockers, keys, stuff like that. And we're also spacing our appointments to allow for less overlap and to keep our waiting rooms with a minimum of patients at 6 feet apart. And as always, we've always cleaned in between patients, but we're definitely paying extra attention to that and also doing deep cleaning of the department throughout the day involving surfaces that normally we wouldn't have paid so much attention to.
Yeah, you hit all the high notes. The screening of the patients, the screening of the staff, the spacing out of the appointments, taking chairs out of waiting rooms, providing an environment for the patients to feel comfortable, change, whatever. Mask on the patient.
Yes.
Mask on the providers.
Yep.
And is anything else really, other than all those things you just talked about, fundamentally, getting a mammogram or getting a CAT scan is really no different today than it was pre-COVID, right?
No, it's not.
And you're going to get your results back just as quickly as you would have in the pre-COVID days. There's really no change there, correct?
Yep. If anything, it's almost quicker now because the patients are still starting to build back up.
So, Lisa, what would be the danger, real, perceived, or otherwise, of delaying a diagnostic or screening test like a mammogram?
Well, I did read an early analysis that was done by the Institute for Human Data and Science that actually predicts, due to the lack of imaging over the last 3 months, there will be an estimated miss of approximately 80,000 cancers due to lack of screening, and specifically for breast, prostate, colorectal, cervical, and lung cancer. That's pretty big. Additionally, overall patient interactions during that time with oncologists were down about 20%. And so in addition, from our standpoint, that's a lack of patients that were getting their follow-ups for cancer. And we're seeing now some of the tumor burden has actually increased on the follow-up, thorax, abdomen, pelvis CAT scans that we're doing as a part of a cancer workup.
So what I'm hearing is that what you're seeing in imaging and mammography and what you're telling us about cancer is it really mirrors what we're seeing in all these other spaces. Like, for instance, when you have a conversation with the ER physician and they tell you that they're not seeing the heart attacks, they're not seeing the strokes, or when you talk to the primary care physician and he says that all of my usual patients are not coming in, this is really no different than any of that. I mean, there's just the entire healthcare system is experiencing this catastrophic delay of people seeking necessary care. Yeah. Well, I think that's about all we have time for today. I want to thank Dr. Lisa Awan for coming on the podcast. Thank you. It's been a pleasure to chat with you.
Yes, same here. Thank you very much.
You bet. So I also want to remind our listeners that all this and more can be found at beaumont.org/safe. We also have a great resource for all things COVID at beaumont.org/coronavirus. And we're going to be doing a series of COVID-19 related podcasts with different subject matter experts on a number of topics in the coming days, such as things like emergency care, surgery, obstetrics, and outpatient care. I also want to remind you to send along any questions or suggestions to podcast@beaumont.org. And with that, I will leave you with this healthy thought. Diagnostic and screening tests like x-rays, mammograms, CTs, and so on are still an important part of the holistic approach to health and wellness, as much today as they were in the days before COVID. If you've put off or delayed necessary imaging or screening because of the pandemic, talk to your doctor today about getting things back on track. Now, probably more than ever, it's important to focus on health and wellness, and your doctors are here to help you get the care you need. Thank you.
Continue your journey to living a smarter, healthier life. Visit beaumont.org/podcast to access information and resources related to today's podcast.